Order, and I call the honourable member for Bowman.
Deputy Speaker, it's nice to wind up the week with a health discussion, and let me just say all the good people are in here this afternoon. All the people with a heart for the health system, and the people behind me in the gallery will be pleased to know that the $120 billion health system has bipartisan passion. But you also need a little bit of memory, and I think today is probably a good time to do a little shout-out to a few Australians, those who were hoping to have their teeth fixed under the CDDS and had it ripped out from under them, for the dreadful crime, no less, of having a job. Having a job made them ineligible under the Labor scheme, and they ripped out their dental care. Let's do a little shout out to those medical graduates. Remember those that couldn't get an internship under the Labor Party? That's right, left until the last moment. And we had privately funded medical students flying home overseas because they couldn't get an internship. Let's have a little shout out to them as well. How about the lovely pensioner couples that were told they couldn't get a cataract? Let's have a shout out to them. Remember we cut the rebate in half? Nickel and diming the health system. I remember Nicola Roxon. Let's just slash that Medicare rebate for cataracts in half and just see how it goes. And at the same time, that cuts in half the payment to the private hospital to do a rebate, to do a cataract operation. So all of those Australians, ladies and gentlemen, have very, very long memories. So while these guys may well have their talking points from the Labor Party, and every time there's a sort of a desperate week with nothing to talk about in the opposition, there's this little frisson of excitement when they find that there might be someone who missed out on a welfare payment. And we can make a story about that. We can get that one rolling, and somehow it just doesn't get reported again. Look, in health, it's pretty complex. Multi-jurisdictional economics, private sector, public sector, private operators, highly technological innovations in health, all of it has to be funded. And I let you know today, Australia is doing very well. Thank you very much. And not much to do with 6 years of absent landlord management from the Labor Party. I mean, let's look over that side of the parliament and just see how much health experience is over there. I'm peering over there. I can see a diligent, I see a diligent union rep over there. Member for Bendigo is a member of passion for social services. She is here today. I can see the member for Griffith, a massive intellect. I think she would barely know the visiting hours at her local hospital. Have we got anyone else there who even knows their way to an emergency ward or could find their way to ICU? The only thing up there is your argument, Labor Party. Your argument belongs in intensive and critical care. This is a complex area. Let's face it, it's health. But you are guilty. You are guilty by omission today of not being clear about your very own cuts. This is a massively exciting moment in health as we have moved towards health performance. And the National Health Performance Agency, one of the 11 that you guys created or extended, and almost forgot for a minute, there are thousands of public servants who say thank you for our jobs in the agencies. Thank you for creating thousands of jobs and the double dipping of PPL that we got along with it. Thank you very much for that. More people created, more jobs created, more water bubblers in the public sector, you know, more places to sit around in the tea room and talk about the healthcare you should be delivering on the front line, but you don't, because you're working in an agency that wasn't making an ounce of difference to healthcare in Australia. Let's get back to the doctors, to the nurses, to the students that are the doctors and nurses and allied health practitioners of tomorrow. They know we need early intervention, and the best that this side could do was an preschool health check for the 4-year-olds. That's right, that's when health started, wasn't it? A preschool check at the age of 4. I mean, virtually abandoning children between 18 months and 4 years of age. No plan for early intervention. This was a government that presided over nothing more than extending and expanding agencies, cutting Medicare rebates in half, and now they have the gall to accuse us of something similar. Far more than that, what is happening now is a rational conversation with general practitioners who, far from what you are saying, are not marching in the street. General practitioners know that we are talking about improving the Medicare system through a review, improving chronic disease management, reducing the 635,000 avoidable hospital admissions. We're in constructive dialogue that you guys never had because you burnt off your connections to the health sector within an hour of being elected. You're a Labor Party that's all talk about entitlements and rights to payments and nothing about self-responsibility, looking after one's own and one's family's health and making sure we can have the best services possible in our communities. Yeah.